All right, so why family medicine? I'm going to give you a bad answer, and then I'm going to give you a sample answer that is considered a good answer, right? So you can compare for yourself. Good question. I chose family medicine because I always wanted to help people. I think I like the idea of working with all kinds of patients, but I didn't really want to specialize in anything, at least right now. I think family medicine is a good option because it's broad and does give me a lot of variety. I also think that it's more relaxed than some other specialties, and I didn't want anything super stressful. So I haven't really thought about it much, but I know that I don't want to go into surgery or internal medicine. So family medicine seems to be the right choice. All right, so you saw that was a little bit of a shaky answer, but we are here so that you are able to answer questions with positivity and with confidence. So why did you choose family medicine as your residency of choice? Let's get to a sample answer that I think you can use, or at least you can take an example of and twist it and turn it into your own answer. And of course, I will have links in the description for 25 questions and answers for the residency. Question and answers for free. You can check that out, and there'll be some other links. Anyways, let's get to the sample good answer. Thanks for asking. And I chose family medicine because I am passionate about providing a holistic, continuous care to a diverse group of patients. One of the aspects that I love most about family medicine is the opportunity to build relationships with my patients and their families. And in my clinical rotations, and I had the privilege of seeing the impact of continuity of care that can have on patient outcomes, especially when managing chronic diseases such as diabetes or hypertension. For example, during my family medicine rotation, I worked closely with a family where the patient had multiple health issues and their teenage son was struggling with obesity. Now we know that the obesity epidemic is a huge issue. Over several visits, I saw how the physician didn't just treat their individual conditions, but also he addressed their family dynamics, nutritional habits, lifestyle habits, emotional health, and all of this led to significant improvements in their overall well-being and a family unit to be a better cohesive unit. I found that incredibly rewarding, and I was witness to this patient-centered care that spans across all ages and not just pediatric or the elderly. I do also appreciate that family medicine allows for a broad scope of practice, and from preventative care to managing acute and chronic illnesses, this variety actually keeps me engaged and ensures that no 2 days are actually ever the same. I thrive on being able to offer comprehensive care that considers not only the physical aspects, but also the social as well as the psychological aspects of health. So ultimately, I'm surely drawn to family medicine because it aligns with my values of treating the whole person and not just a particular disease. I'm excited about this opportunity to work in a field that allows me to serve diverse populations and to address the unique healthcare needs and challenges of entire families and communities. Thank you for asking this question. Thank you so much. That was probably a better thought of answer with an example in the middle. So examples are always good because people can then relate with it. If you just keep on saying things, I like this, I like that, that doesn't really fly. But now moving to the framework of answering this type of a question. Start with something as a personal motivation. Explain that you're drawn to family medicine. Explain why. Mention specific aspects of the field that truly excite you, such as the continuity of care or the diversity of patients. Then a relatable example. Provide a concrete example from your clinical rotations or your experiences that show how family medicine does resonate with you. And then, discuss about the broad scope. Highlight the variety of cases in family medicine, from preventative care to chronic care, and how this aligns in your personal interest. Now, connect with personal values. And how does it connect with you personally as a person? You have your motivations. So explain how family medicine aligns with your core values, such as providing patient-centered care and not just focusing on one aspect of it, right? So in addition to this, you see the benefit of a long-term impact on the community. And then lastly, I would say look to the future. And by discussing how family medicine will help achieve you in your career goals and how how it allows you to continuously learn and grow. So that was a bit of the framework. Do's and don'ts. Let's talk about some of those. The do's: show passion. You gotta show passion. You gotta show that you're passionate about what you want to do for the rest of your life. Make sure that you show some type of enthusiasm. Give a specific example, as we gave a specific example. Mention positives, continuity of care, a holistic approach, and show understanding of the wide variety in family medicine. I mean, in family medicine, you can later on you can do things such as cosmetics. You can do minor plastic surgeries. You can open up holistic health centers that are the rave these days. So family medicine is not just family. You have a clinical office and you work in that. In the future, you would be able to do a lot more when you specialize. You can even go into sports medicine perhaps. So family medicine can branch out into many different specialties. And I've seen family medicine physicians man the ER, perhaps. They can also round in the hospital. So family medicine is just not limited to a physical clinic location. So the don'ts: I wouldn't dismiss any other field. I would never dismiss that. That would sound like that you are a bad person to begin with. So don't do that. Don't be vague with your examples. Be more specific. Okay? Don't be general or sound very naive, such as, oh, I like helping people. Okay, well, everyone on earth probably likes to help people, with something, right? So don't be that general. So basically, you see that a well-prepared, a thoughtful answer can actually make a huge difference in how you are perceived in an interview. Make sure that you do highlight your passion, provide relatable examples, and demonstrate a deep understanding of why family medicine actually aligns with your values. So this is what I talk about on this channel. Thank you so much. I'm Dr. Umar Khan. Talk to you soon. Bye-bye. You need some more help looking to connect? Then I will have links in the description. And you can probably find my 25 questions and answers, a PDF. Gives you the questions and the answers, and you can practice on your own. You need further help? You can check the link in the description as well. Possible sessions with small groups as well as possibly one-to-one. And if you want to become a member of my channel on YouTube, and we will be having live interview preparation sessions as well, consider becoming a member there as well. And of course, we'll chat over on Facebook as well. I will have all the links for all of my social handles in the description. Hopefully it helps. Thank you.